On the 29th of July, Sri Lanka recorded 2,370 new COVID infections. Fast forward 11 days to yesterday, the daily caseload has risen to almost 3,000. One of the chief contributing factors in the rapid rise in new infections has been the feared Delta variant, which is suspected to be the dominant variant in the Western province. As new infections rise, the healthcare system comes under stress. Several hospitals within the Western province and a few outside it have started to feel the strain. The Colombo South Teaching Hospital in Kalubowila and the Colombo North Teaching Hospital in Ragama started to run out of beds for COVID patients. Footage allegedly showing COVID patients lying on the floor without beds started to emerge. With that being the case, State Minister of Production, Supply and Regulation of Pharmaceuticals, Professor Channa Jayasumana, yesterday visited the Colombo South Teaching Hospital in Kalubowila to look into the situation there.
ඒක తాවකාලිකව ඇතිවෙච්ච තත්ත්වයක් පමණයි. මොකද අර PCR සහ rapid antigen පරීක්ෂණ කරලා වාට්ටු වෙත යවනකම් ඇතිවෙච්ච తాවකාලිකව ඇතිවෙච්ච තදබද තත්ත්වයක් පමණයි. නමුත් අද වෙනකොට ක්‍රමානුකූලව මේ සියල්ලම යථා තත්ත්වයට පත් කරලා තියෙනවා. දැනට රෝගීන් ප්‍රමාණයක් සිටිනවා නිවෙස්වලදී ප්‍රතිකාර ලබන. ඒ වගේම තමයි කළුබෝවිල ශික්ෂණ රෝහල තුල අලුතෙන් වාට්ටු දෙකක් හඳුන්වලා දීලා තියෙනවා COVID-19 රෝගීන් සඳහා. ඒක නිසා මේ රෝගීන්ගේ තදබදයක් මේ වෙනකොට කළුබෝවිල ශික්ෂණ රෝහලේදී දැක ගන්න නැහැ. මృత ශරීරාගාරය බලන්න ආවා. එතන විශේෂඥ අධිකරණ වෛද්‍ය නිලධාරීතුමත් සමගත් අපි සාකච්ඡා කරා. මේ වෙනකොට මේ මృత ශරීර එකතු වෙන තත්ත්වයක් කිසිසේත්ම කළුබෝවිල ශික්ෂණ රෝහලේ දක්නට ලැබෙන්නේ නැහැ. මෙතන යම්කිසි ප්‍රශ්නයක් තියෙන්නේ ශීතාගාර 37කින් 20ක පමණම COVID-19 නොවන රෝගීන්ගේ පැරණි මృత ශරීර තියෙනවා හඳුනා නොගත්ත. ඒකට නීතිපති දෙපාර්තමේන්තුවේ උපදෙස් අරගෙන ඒවා අධහනය කරන්න එහෙම නැත්නම් භූමදාන කරන්න මේ සතියේදී කටයුතු කරගෙන යනවා.
Meanwhile, today the State Minister visited the Colombo North Teaching Hospital in Ragama. Speaking to media, Professor Channa Jayasumana said that the overcrowding that prevailed at the hospital is brought under control successfully by the hospital staff with the support of the local political authorities. In the meantime, with reports of dwindling COVID treatment facilities coming to the public domain, the Health Ministry today gave an update on the present state of COVID beds and PCR testing.
In 224 treatment centers, there are 33,962 beds available, out of which at this moment 32,762 beds are being occupied. At the moment, there are 89 ICU beds occupied for the treatment of COVID-19 patients. And as reported yesterday, there had been 18,704 PCR tests performed over the previous 24 hours.
Yesterday, there were 2,961 new cases of COVID-19 confirmed in the island. 852 of them were recorded from Colombo district, which is 28% of the total figure. This reaffirms that Colombo continues to be a COVID hotspot. Kaluthara meanwhile confirmed 320 new infections, while Gampa confirmed 319. Further 255 fresh cases were detected from Gaul, 187 from Ratnapura, 142 from Kandy, 135 from Kegol and 113 from Jaffna. The remaining 18 districts accounted for 633 new cases. Yesterday's caseload also included 5 imported cases. Though much of the blame for the recent rise in spread of the virus has been put down to the Delta variant, public behavior also isn't helping the situation. With certain restrictions relaxed, health authorities say that people are abusing the freedom given to organize certain events. What's more, they say that various small clusters have formed centering weddings, funerals and parties, leading to the conclusion that there were non-adherence to health guidelines at these events.
We are not going to close down the country because of the economic reasons. Most of the countries in the world also follow the same rule. But we have imposed certain restrictions, especially for people with comorbidities and pregnant mothers and the shift system in the public sector and the private sector. These are to reduce the number of people in one place. So even though we impose these laws, if people gather together at their localities, homes, the parties, the votes and everything, then the idea of these regulations will be completely lost.
In any case, if and when you are infected, health authorities say that it's imperative to seek medical assistance as early as possible.
If you have any symptom, you have to go to a doctor or a hospital as quickly as possible, because initial stage, if we treat people, they get better. But if you go at the last moment, when you are hypoxic, when your organs are failing, when your other ailments have gone uncontrolled, then it is very difficult to control your illness. Remember, this problem will go on for another couple of years. So we'll have to follow our regulations and rules meticulously during that period in order to completely get out of this pandemic situation.
With the confirmation of 1,928 new COVID infections today, the country's number of active cases jumped to 31,298. There were also 2,161 COVID recoveries as well, taking the overall tally to 295,518.
Glow and handsome. ඇති multivitamin සහ UV filters දෙගුණයකින් වැඩි දීප්තියක් ලබා දෙයි.
මූණ ගැන හිතන්න. හිරු කිරණින් ආරක්ෂා කරගන්න.